55-year-old male patient with tiredness.
Okay, call me in.
Can come in? Yes?
Hello,
Hi.
Mr. Smith.
Yes.
My name is Dr. Sajid. I'm the attending physician here. I'll be in church today. Would you like to be addressed today?
Can you both of you speak louder?
Yeah, John is fine.
John is fine.
Yeah.
All right. Could I ask you to move over here, the bed, please?
Sure.
Thank you. So in the next few minutes, I'll be asking a few questions to get a medical history from you. Is that okay?
Yeah.
All right. Can you please tell me what brought you in today?
Well, Doc, I've been feeling really tired for the past 3 months, and it's been really interfering with my activities and my life overall.
Right. Sorry to hear that it's been bothering you that much.
Yeah.
I'll try my best to help you out. Okay?
Thank you, I appreciate that.
You're welcome. Okay, so let me ask you this. Have you been feeling really intolerant to cold when you walk in to a room or something, or even outside when other people are not feeling cold?
No.
No?
No.
Okay. Have you noticed any change in your skin tone, skin color?
Skin color, no.
No, nothing, no change in skin, okay.
No.
Any change in weight?
Weight? I think I lost some weight.
You lost some
Yeah.
weight? About how much, do you know?
About 15 pounds.
Was it intentional or unintentional?
No, I didn't plan on doing so.
No, okay. And over what period of time?
I guess 2 months.
In 2 months?
Yeah.
Okay, all right. Have you noticed any swelling anywhere, especially in your legs?
No.
No. Okay. Have you been looking more pale lately? Did anyone tell you that you look more pale than before?
No.
Nothing
No.
like that. Okay. Any fever?
Fever? No.
Any chills?
No.
Night sweats?
I occasionally wake up in the middle of the night, just going to the washroom, yeah.
Going to the washroom?
Yeah,
Okay.
but, and I feel like I'm a little bit sweaty, but it's nothing that's serious, I guess.
Mhm. You woke up at the middle of the night to go to the bathroom. Is that something new, or you just started something recently?
No, I always wake up, like maybe it could be related to, I like to have a cup of chamomile tea, so sometimes it has this diuretic effect on me, so I'll wake up in the middle of the night.
I see.
Yeah.
How many times do you wake up at night to go
Once.
to bed? Just once?
Once, yeah.
Oh, okay. And what time do you go to bed?
To bed?
Yeah, at night.
Well, I like to go at 10 because I'll wake up early.
Mhm. Has anything changed in your daily life recently? Like any major
Yeah.
stress, like financial stress or family stress?
Well, not in that aspect, it's just I don't have energy to enjoy my activities, you know.
Yes.
Like I like to go for hikes, I like to play poker with my buddies, you know, from back in the day,
Yes.
and then I just don't have
You can
energy
hear
to
that,
do
right?
that.
I see. All right. Do you snore at night?
Snore?
Do
No.
you snore at night?
No.
You don't. All right. Okay, now,
I actually sleep like a baby. Yeah, I
That's
sleep
good.
really good,
All right.
yeah.
Okay, now I'll be asking a few questions just to see if I get a sense of overall health of your body, okay?
Sure,
All right. Do you
yeah.
have any headache?
Headache? No,
No, no headache. Any visual disturbances?
no,
Any chest pain?
no,
Any shortness of breath?
no.
Any change in bowel movement?
Well, like, I'm at that age where, you know, old people, they get constipated, but I try to eat some fruits, you know,
I
and
see.
it seems to help.
Does that help? Okay.
Yeah.
Did you try anything to make this tiredness better? Does anything work?
Well, I try to sleep more,
Mhm.
and it's kind of helps,
Mhm.
but then I still get tired, you know.
Did you notice if anything makes it worse?
Worse?
Mhm.
Not really.
Okay. All right, so let me continue about the other questions that I
Sure.
was asking about your general health.
Sure.
Any change in urinary habits other than going to the washroom at night? Any other
No,
change in-
no,
No burning sensation, nothing like that?
nothing like that, no.
All right, any joint pain?
No.
All right, let me ask you about your past, about your medical history in the past, is that okay?
Okay.
Do you have any medical condition, like diabetes, high blood pressure?
Well, I have a high blood pressure, but it's been controlled for years.
Okay.
Yeah,
You take medicine for that?
yes.
What do you take?
I take Betalol.
Okay, all right. So you take it daily?
Yeah,
All right. Any other medical condition?
no.
Have you had any surgeries in the past? Or-
Yeah, when I was 18, I had my appendix removed.
Mhm. Anything else? Nothing. No major accident or hospitalization?
No.
Okay. All right. Are you allergic to any medication?
No.
No. Okay. Other than the beta blocker, do you take any other medication? Like over-the-counter medication or any other medication?
Well, my doctor told me that I can take some vitamin D and calcium, but it just makes my constipation worse, so I stopped it.
Okay. Is there any family, in your parents, is there any chronic disease that run in your family?
2 minutes.
Not that I'm aware of. I know that my uncle has some issues with his stomach, but other than that,
Other than that, no?
yeah.
All right. Okay. Now I would like to ask you about some your personal habit and lifestyle questions. Okay.
Sure.
Do you smoke?
Smoke? Yes, I do.
How much?
About a pack a day,
About a pack a day?
Yeah.
And for how many years have you been smoking?
25.
25 years?
Yeah.
Okay. Have you thought about quitting?
Not really.
Not really.
No.
Okay, if you're interested, let me know. We have many programs and many ways of helping patients to quit. So if you're interested, let me know. We can talk about it.
Okay.
Do you drink?
Yes, I do.
How often do you drink?
Like on the weekends when I used to meet with my buddies to play poker, we had some
I see.
beers.
How
Yeah.
much do you drink?
About 2 bottles of beer.
In a week? Okay.
Yeah.
All right, do you do any other drugs? Any recreational drugs?
No,
Cocaine,
no.
nothing
The
like
doctor said it's bad for my health,
Okay.
so.
that? Have you tried it in the past?
No.
No, okay. All right, are you sexually active?
Yes, I am.
Are you in a relationship?
Yes, I am.
You are. May I know, is it your girlfriend or a wife?
Oh, I've been happily married for the past 30 years.
Okay, all right. I don't mean to offend you, but are you sexually active with one partner or multiple partners?
Yeah, just my wife, yeah.
All right. Okay. And what do you do for a living?
I work at the factory.
How's this tiredness affect your work?
Well, I can barely make it through the day, and for the past months I had to take a couple of sick leaves because I wasn't able to finish my
I
work
see.
because of this
Sounds
tiredness.
like it's bothering your life. Really.
Yeah, yeah. It's,
All right, thank you very much for answering all the questions for me, and we'll come up with a working plan together based on the history that you have given. Okay?
Okay.
Thank you very much.
Consultation.
Thank you.
Thank you. Okay.
Good.
That you were brave enough to be here today.
Yeah.
It's so
brave.
very nice. It's a good practice, guys. No matter how we talk about it here, no matter how many times I emphasize some stuff, unless you do it by yourself and video record yourself and audio record yourself, it will not be the same, right? Do you?
Please share the screen. We went blank for a
There
minute.
is nothing on this.
There is nothing on the screen.
Can
You're
you see,
blank?
can you see Ivan?
Yeah, we can see anything
Can you
now.
see my hand motion?
I can see it now.
Okay, so everybody can see that. I was just shared the screen and I was just showing you the time. So what is your working diagnosis, Dr. Manila?
So on the very top of my list, it would be hypothyroidism. I was thinking.
Did you find any evidences for hypothyroidism?
Yes, constipation, then changes in weight,
Okay.
and that's about it. For
What are your differential diagnoses?
differential diagnosis? I had HIV, anemia, depression, obstructive sleep apnea, cancer as well. It was in my list of neoplasm, and then poor sleep hygiene.
Okay. So we didn't practice on tiredness yet. It was good that we did it now, so you have actually some mental picture of what you want to do. So what is your plan for this patient?
To start with some investigation, such as
Like?
CBC, then TSH to check the thyroid. And also, I would like to get a colonoscopy, and because of the age, given the age over 50 years, and history of constipation to develop cancer.
So starting on the road.
Microphones at the other side off, please, okay?
Okay. And also,
You would
Lost
do
my
it
mind.
definitely,
And the sleep-
you would
sleep
definitely
study.
do it fantastically in 15 minutes. In 15 minutes, you would be 100% fine, okay? But for doing it in tiredness is not an easy case, guys, okay? The same way it wasn't that easy. He asked a lot of good questions.
She go,
Yeah.
no.
He asked a lot of good questions, and he ruled out a lot of stuff. But the major thing about tiredness, I will talk about it. Sleep hygiene, you should first of all, any patient who is
Yeah,
really
was-
tired, you should rule out, is he sleeping well or not, okay? The other thing is what? Is it more something psychological, tiredness as depression or something like that? Or it's more something organic. Okay? As you can see, Dr. Monira is telling me sleep hygiene, one from this column, one from the first column, one from here, depression, and one from here, colon cancer, for example, and hypothyroidism. Okay?
So I was asking about any stress
That
or
is-
depression.
that is
and
okay.
stuff,
But the fact that you didn't ask that much about you didn't tell enough
I'll
what the
finish, I'll
opposite,
give my
maybe
feedback too.
constipation and maybe diarrhea, okay? So, what is your next plan? So another doctor will do that, or you want to?
No, like, I'll just give you my feedback, but you finish first.
Your, okay.
But because you
So
finished.
I'm not actually, I will not solve the question for you now, because I didn't talk about tiredness yet. So I want to keep it as a mystery. So when we get to the tiredness, you know what exactly you want to do. Dr. Monira did a great job, but with tiredness, okay, in the exam, you should do a better job if you want to get a high score, okay? It was average high, I can tell you, I don't want to disappoint you, and and for tiredness,
I need honest opinion.
That's why they're here.
That's why-
If they were
and for tiredness, it's fine. Okay, for tiredness, if you're approaching it for the first time, here in front of all these people with this stress, the fact that he was brave enough to come here was really appreciated, okay? You were fluent, you had a good communication with your patient, you asked a lot of good questions,
But a little
okay?
bit too
It
fast.
was somehow organized, but at the same time, you know what? You were pulling a thread and they were just leaving it. You were pulling this and you were
Yeah.
just leaving it. You were pulling something and you were just
And I was
leaving
trying
it.
to help you.
That's
too.
why toward the end, you are here, sleep hygiene, okay, or depression, or colon cancer, anemia, or hypothyroidism. So even toward the end, you have this much differential diagnosis. Of course, all of them, sleep apnea, all of them can cause tiredness. You were fantastic, your theory is fantastic,
Yeah.
right? But in the practical case, they want to see how competent you are to figure it out in 10 minutes, right? If toward the end, you're at least a little bit from here, a little bit from here, a little bit here, here, you're actually double dipping from everywhere, right? So this was a it was intermediate approach, okay? But you can be triumphant. When I solve the equation for you, it would be much easier for you. Your feedback, sir.
Okay, my feedback, I'm just going, like, I'm not trying to,
No,
I'll
that's
just
okay.
be,
I need honest
like, it was
opinion.
really good, the introduction was good, and, I'm not sure which, do you use Dr. Basil's notes to study, or like, how do you, which
No,
one?
no.
It doesn't matter, right? Okay, when you,
Somewhat both, yeah.
yeah, so when you're zooming into the, like, if you have an idea in your mind that I have cancer, like, I want you to explore more, like, when you started asking about any problems, because you did a good system review, you went from top to bottom, but I told you about constipation, and then you jumped to something else. You didn't follow up with anything, like, what else would you ask regarding GI system?
Diet. How is your diet?
Right.
Diet.
Change the diet.
And then what about my stools? You didn't ask about that, that's very important, because I noticed.
Constipation, what about any notice, what about when you pass a stool, do you notice any change in it? What about the caliber of a stool, right? You ask a lot of good questions, no offense, right? You ask a lot of good questions, but you know what? You were more worried about the checklist rather than interaction with the patient. Okay, I asked this, what they forget? Okay, let's touch it and go, let's touch it and go, let's touch the base and go, okay? You were not catching it, you were just touching it and go, right?
And then, yeah, and your differential, did you write your differential while you were there? When you begin, it's always good to, usually the patient has to tell you something. So you shouldn't open up saying, do you have any problems with your weight or like any changes in my skin? You should ask me more about, can you tell me more about your tiredness? What do you mean by tiredness? Things like that. Does it mean
Tiredness,
yeah.
dizziness, these kind of things, you need to actually clarify more. What do you mean by tiredness? Is it lack of energy? If it is more lack of energy, or is it feeling down or depressed?
Yeah.
Okay,
If it's
what about
organic
your
or is
sleep
it-
pattern?
And then just clarify, and then about depression, you know mnemonic, right? Am I best? Ask him around me two things, like how's your mood, how's your interest?
Interest.
If
Mood and interest.
mood
If you
interest,
asked it and it's not there, depression is not there.
just leave it, then
Mood and
move to
interest.
organic causes. And then with the organic causes, if you still can't figure out whether you did really good constitutional. Constitutional, like when you started, you should have gotten a hint that it's a cancer. Because I told you about weight loss, so you can't think it's hypothyroidism. It could be, if it's hyper, then maybe. Hypo, they don't lose weight. So then you work down system by system, and you almost got there. And then, but you didn't ask about bleeding, and I told you that one of my relatives also had problems with
The
stomach.
stomach, what was the problem?
Yeah, what was the problem?
Maybe stomach cancer, right? Maybe stomach
So
cancer.
just a little bit of organization, but overall you ask like a lot of important
A lot of
questions.
good questions. A lot of, thyroid, definitely you have to touch it. Anemia, you have to touch it.
Yeah.
Heart problem, you have to touch it.
Diabetes.
All of them cause diabetes.
Diabetes.
All of them cause tiredness. About diabetes, do you eat more, drink more, pee more? Because drinking more, eating more, peeing more, and tiredness is diabetes unless proven otherwise, right?
But overall, just like try to organize it a little bit, systematically, and then you're fine.
Any feedback from the,
Can I
any
just-
feedback from the other
Very
doc, any feedback from the other doctors?
I think that he did.
Give me a
very-
second. Dr. Anna.
I'm sorry, very empathetic, and was really good that he said, I will consult
Empathic.
you
You
on.
couldn't see his face, but his
Yeah.
face was really empathetic.
Yeah.
And he was actually, he was acting like a doctor.
Yeah, he was
Yeah.
engaged.
He was doing a
and
doctor
engaged
job.
too.
Consultation on smoking cessation.
That was
Really
good.
That was good
that
as
he
well.
took his time
Dr.
to
Upas-
say that.
Done? Dr. Upasna?
And he made me very comfortable about sex history.
Sex history.
Yes,
I felt comfortable.
That was a really
I
good way
didn't
to ask
feel-
someone who's married, do you have any other sexual partners? He said, I don't mean to offend.
Mhm.
Yeah, so that was good.
Good.
Yeah.
Any other comment? Any comments from you guys online?
I think
Dr. Sumaya.
I think he was very reassuring because his tone of voice, his competency, and his professionalism are all very reassuring to the patient too.
Any comments online?
We can't hear you guys actually.
You can't. Okay, louder guys, louder, like me. Speak like me. Can you hear me?
Yes,
If I go there, can you hear me?
we need microphones.
So, next case, you're done?
Yeah.
You're done? Next case.
So let's
Let's
move on.
move on. A brave person. Sorry?
You wanna do it? Yeah.
Can you maximize the window like we're-
Maximize, maximize. I will maximize it for you.
Congratulations for being the first.